Hi, all our friends out in Head for the Cure land. I'm thrilled today to be joined by our partner and friend, the head of neuro-oncology at Huntsman Cancer Center in Salt Lake City, Dr. Howard Colman. And first, before we get started, I want to remind everybody of our upcoming event in Salt Lake City on May 14th at Liberty Park. Funds from Head for the Cure support Huntsman and also the Musella Foundation, a partner that we work with very closely, the Utah Brain Alliance. So it's going to be a great event. We can't wait to team up with Dr. Colman and the team at Huntsman to put this event forward. If you wouldn't mind, just tell us a little bit about your program at Huntsman and how things are progressing.
One of the great things about Head for the Cure is the focus on finding and bringing new treatments to patients through novel clinical trials, and that's a big focus of our group here. So we have a very active multidisciplinary group in neuro-oncology, neurosurgery, radiation oncology, neuroradiology, neuropathology. And I'd say we have a couple focus areas. We have a trial right now for trying to increase dose of stereotactic radiosurgery, mainly for brain metastases. We have an interesting therapy coming into early phase trials for both adults and kids.
Oh, that's great.
For antibody targeting CD47, which is part of the immune system regulation. And so the idea there is to try and activate the immune system in a way that allows the immune system to attack the tumor. So we're very excited about that phase 1 study that will open soon. And then, part of the larger brain tumor community working on a number of different trials that are open in multiple places around the country, including the GBM Agile trial, which we're participating in, excited about. So lots of things going on at various levels, from early phase to later phase, and a lot of kind of discovery on the biomarker and drug discovery side. So a lot going on.
It's great to hear that there's progress. Over the years, I know we've been on this evolutionary path, and it just feels like there's a revolution waiting around the corner, and it takes time behind the microscope and patience, willingness to. That's the notion of sort of continuous discovery, isn't it? And the value of clinical trial. Helping patients today helps patients tomorrow.
Yeah, and I think that also kind of plays into this, term, which is a little nebulous, but learning healthcare system, where you've got the clinical trial part, but then we've also got a lot going on outside of clinical trials and trying to use all of the information that we gather from individual patients and retrospective studies where we're looking back over the patients we've treated and trying to put all that information together to come up with the best treatments and the best trials going forward for individual patients.
Thanks for all you're doing for brain cancer patients. It's an honor to work with you, and really looking forward to our event next week. Head for the Cure. Thanks everybody out there who's participating, who's supporting.
And we appreciate you bring the event and all that Head for the Cure, your Musella Foundation, and other organizations have done for the brain tumor community. And we really appreciate it and hope everyone has a good time.